Namaskar. This week we have very interesting information on the situation in countries which have attained a very high level of vaccinations. Now all those questions in our minds and in the minds of the scientific community, because they have also been experimenting on this, as to what will be the effect and what has been the effect. We are beginning to get some solid data from different governments around the world. Let us have a look at that now. Among the nations who have attained a very high level of vaccinations are Israel is right at the top, I think, and then the United Kingdom, the USA too, and then many European nations. These have achieved such a high level. It was told in the beginning that if 40% of the population is covered, we can really breathe easy, and if 50% are covered, that's good. If 60 and more are covered, you can rest assured that the entire community is safe, and there aren't going to be infections. They're going to fall, and we have won the battle against COVID-19. Before it began to accelerate its campaign, no less than the World Health Organization said this about Israel, and I quote, "The world is now watching how the pandemic in the country evolves to assess whether vaccinations are having the intended effect and how effective they might be in preventing infection and how effective they might be in preventing disease and death." Now this is a very precisely worded objective, and quite rightly so, because even the WHO at that time and the various governments who gave permissions for emergency track vaccination approvals without the necessary trials, even they didn't know whether it's going to be helpful or not. Now we have reached a stage where Israel has fully vaccinated, double doses, over 75% of its population. It's a remarkable effort in terms of the government, the medical administration there to achieve this. And also simultaneously, they are continuing their daily tracking of COVID-19 cases. So we have an enormous amount of data now. So now we can see how efficacious, if that is a word, this vaccination is against this infection. And I would like to share that with you. An important finding from the Israeli data set is that the efficacy of the vaccination drops rapidly with time. At the beginning, the makers of the vaccine had said that it will offer a protection of up to 93%. But the data reveals that for those who were vaccinated recently, say in April, the protection offered by the vaccine is down to 75%, which means many people who are vaccinated are also getting infected again with COVID. Now for those vaccinated in March, 1 month before April, the protection level of the vaccine goes down to 67%. And for those vaccinated in February, the protection offered by the vaccine drops rapidly to 44%. And for those vaccinated in January, which means about 7.5 months ago, the protection offered by the vaccination crashes to a mere 16%, which means a lot of people who are getting COVID cases also happen to fall in the category of those vaccinated in January. This is a finding which Israeli government and the World Health Organization and others are having a serious look at. Because that is what the purpose was at the beginning, that we do not know whether these vaccines will succeed or not. We do not know to what extent they will succeed until we wait for the data. Here's the data. Now let us have a look at the United Kingdom, where 72% of the population has been vaccinated twice, of the adult population, and more than 81% has received a single dose. Now last week, their COVID symptom tracker gave the information that 60,000 new infections have been seen, out of which 26,000 were among those unvaccinated and 24,000 were among those vaccinated. 40% of that figure were among those who were double vaccinated, who had both the doses. Now this information is in sync with the data coming from Israel. And if we move on, let us take the United States of America, which is again another country where an aggressive program for vaccination is underway. And unfortunately, recently, there has been a climb in the number of cases in the US. And CDC, which is the Center for Disease Control there, has reported that about 1.25 lakh people who have been vaccinated have got the infection. Of course, as a percentage, this is a small percentage compared to the people who are vaccinated. We are not giving these statistics here to panic you. We are saying that this is exactly what was required by science, data. And these data sets are coming in, and they are, questioning many of the very, very aggressive and ambitious claims of the vaccine manufacturers. All this evidence is very important because that is how science works, isn't it? We cannot have this kind of blind faith and blind superstitious faith in something which is vociferously being and aggressively being pushed towards us. And these data sets, I'm sure, will make them think harder, because let us not forget, right at the beginning, the possibility of a successful vaccine against a virus like this was always doubtful. Even the medical community said that it is doubtful. Just look at the history. I mean, there is no licensed vaccine against Ebola, but it came and went. There is no vaccine against SARS, an acute respiratory syndrome. Many of its effects are similar to that of COVID. There is a flu vaccine which is now seen to be completely useless, and there is a vaccine against H1N1 which, when tried, they found that its efficacy drops rapidly, just like this one dropped rapidly in Israel. Now all these facts are before us. That the difficulty of having this vaccine, if we consider that, then we can say, okay, well done boys to the pharma industry, you tried, but it's not working. But I'm afraid it's not as simple as that, because the kind of investment that has been put into this vaccine, the monetary investment, the political investment, that will not make them allow science to do its work. So they're going to keep pushing at it. You see, both the pharma industry and the governments and the mainstream elite which are backing the vaccination approach, they are now changing their story and saying that we never said that vaccination will prevent infection. Really? Anyway, but what we are saying is that you'll get infected, but it won't be so serious. And that the number of hospitalizations among those infected will be less in case you're vaccinated. That's really changing the story. And this doesn't work, especially in other countries, other nations, other communities outside of the very severely affected cities. Where 90% of infected people were anyway not serious, where less than 5 to 10% of people reached hospital, where less than 1.5% have died. In such communities, in such districts, in such nations, this story, is really meaningless. That vaccinate the full population, and then we will guarantee exactly that which was happening anyway before vaccination. There is another issue here which has cropped up, and that is of either governments or corporations. How much power do they have to force you to take a vaccine? This has happened with, say, Google and Facebook. They have mandated that if you want to continue working here, you must be vaccinated. Now, apparently the US government is also considering it, but there are huge voices of dissent, even among the medical community. Here are vaccines which are not yet proved their efficacy, and their adverse effects, will only come to be seen much later, as is usual in such cases. And also, it somewhere goes at the very heart of of diversity, of diverse ways of looking at medical health, and to force someone to have a vaccine when he believes that he doesn't want to take it is something that goes to the fundamental level of coercion. And this is a subject which is likely to come up in India too, as I heard last week. A collector in one district, Kutch in Gujarat, mindlessly, issued an order saying everyone, all adults must get vaccinated, which has been, of course, challenged because in India, vaccination is voluntary. That is the legal stand. It is also the ethical stand, according to me. It is voluntary. And if you find anyone in your vicinity, acting like that collector did there, any government person saying that it is mandatory, that it is, you can object and you can file your protest. One thing which has to be addressed here is what is natural immunity. Now that is the most important part in all this, because natural immunity studies done, there have been many studies done, they clearly show that if a person has had COVID-19, more than 10 months to 1.5 years after that, he is protected against reinfection. And also he is protected against many of the new variants that come. A problem with the vaccinated approach is that sometimes it doesn't work. For instance, it's weak against the Delta variant. So the people who have been vaccinated against the Alpha variant, most of them are getting the Delta variant infection now. Whereas a person who got natural infection from an Alpha or a Beta variant is not getting the Delta infection as much as the vaccinated person. These facts are available. These studies have been done. Natural immunity is important for us in India for another reason. We have to think from our perspective, and natural immunity is something which is promoted by our thinking, our medical science, which is Ayurveda, and there are various ways to improve boost our natural immunity. One, so that we do not get the infection, and two, once the infection is there, it will be very mild. And once you get the infection, which is mild, you are then protected naturally, in a way which is much more beneficial to the human being, much less dangerous to the human being, rather than inject some chemical inside. This viewpoint must also have its place. It must have its say. And those scientists who are in favor of this, those intellectuals who are in favor of this, especially in a country like India, because all our thinking about health, about the way we cook our food, the way we grow up with advice about seasonal, regional, etc. All that points for our society to really go in favor of natural immunity. For those who want to take the vaccination, yes, please go ahead and take it. This is my advice to my friends. If you are taking it, take it with full faith. Say that yes, I want it to work. Put a little prayer up there, maybe it will. But if you want to go for natural immunity, you must study all these in a little more detail. The difference between going for immunization and natural immunity is, in the immunization method, you don't have to do anything. You can continue living the way you are. Maybe your lifestyle is wrong, maybe it is bad, maybe the food you eat is wrong, maybe it is bad. It's all right. You just go, stick out your arm, get the jab and come back and continue to do the same thing. Well, if you're that type of person, vaccination. But natural immunity means becoming alert, aware of our own health, of how our body is responding to the environment, and taking active decisions to change our lifestyle, to going for preventive measures. Now that needs a mindset which is a little different from that of the vaccination mindset. I'm sharing all this so that we can all be healthy, we can all be happy, and see you in the next video.